The City of Toronto's COVID-19 media briefing for Wednesday, November 18th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen Davila. Mayor Tory?
Well, Brad, thank you and good afternoon. We continue to see COVID-19 spreading in our city, and the numbers continue to go in the wrong direction. I want to stress that what is so troubling about these numbers is that each one represents a person in our city. Each of the numbers represents a person in our city. They're one of us, a family member, a friend, a co-worker, a neighbor. They're our fellow Torontonians. Today, Dr. Davila will be reporting, sadly, tragically, that 22 people have died of COVID-19 since yesterday, the highest daily number that we've seen since the beginning of this resurgence. I want to express my condolences to the family and friends of the 22 people and all Torontonians who have died from this virus since the beginning of the pandemic. Another important number that Dr. Davila will update you on today is our latest percent positivity, the weekly average percent of provincial lab tests that come back as positive for COVID-19. That number now sits at 6.2%. Our public health officials tell us that alarm bells start ringing and action needs to be taken when that percentage rises above 3%. Again, our number is 6.2% for the City of Toronto, the entire city, and we know, of course, that within the city there are areas where it is far higher than that. These are the startling figures we heard in our command call that we have every morning, where we review all the numbers and all the different measures we're taking and go back over and over the different things that we are trying to do to keep Torontonians healthy. And I believe it is important to share these numbers with you today, and Dr. Davila will highlight some of them further in just a moment. We have taken action to ensure that Toronto was moved into the red zone and that we've implemented further measures beyond that on top of the Province of Ontario framework. We have the most restrictions in the province in place to try to slow the spread of COVID-19. We believe that was the right thing to do. These restrictions were not recommended or put in place lightly, as we understand some of the consequences. But throughout, we have been trying to do the right thing overall now to avoid something much worse later. As we've said many times, the virus takes time to spread. You could be infected and not test positive for 2 weeks, so it takes time to turn the numbers around. So the sooner you act, then the sooner you're going to get some improvement. We saw that in the spring when we flattened the curve. I support doing everything we can based on public health advice to stop the spread of COVID-19 in our city. Based on all the advice from public health officials, I believe this means taking further steps now. We have been working with the Government of Ontario and our surrounding cities and regions in the public health domain with their public health officials to determine the best way to put the brakes on this virus. It is better and easier for everyone to understand and to comply if we act together. Dr. Davila has made recommendations to the province, which I support. They are giving that advice serious and careful consideration, as well they should, and we expect to have a response from them sometime soon. This virus doesn't respect municipal boundaries or which government or which plan things are done under, which is why we believe the province is best poised to implement further public health measures. Provincial action is best, and I believe it is necessary. But, as we demonstrated before, we, the City of Toronto, will not hesitate to find a way to take action to the extent we can to address this urgent situation. The simplest advice we can give people, regardless of any orders or color-coded frameworks, is this, once again: please stay home as much as possible. Only go out for essentials, not early Black Friday shopping, and by the way, please prepare to stay home on Black Friday too. That's a good day to stay home and not to go shopping. Wear a mask, wash your hands, and if you're sick, get tested and stay home until you get better. Finally, I want to speak directly to two important groups who can make a big difference right now to help us stop the spread of this virus. And I think in the case of both, you'll hear some numbers from Dr. Davila that will have you better understand why. First, to all the parents who are out there who are much more likely to be watching a media update like this than their kids. We are seeing increasing test positivity in young people, really young people, and Dr. Davila will show you just how big those increases have been. We are working to speak directly to them on TikTok and other platforms where they're more likely to get their news with the greatest of respect than through briefings like this. The TikTok messages I've been asked to do, and sometimes at some embarrassment to myself, have been viewed almost 1 million times already, with more to come, and hopefully that's helping to get the message across. But we need your help, parents, in reminding kids that they should not be socializing with their friends after school. They shouldn't be going over to each other's homes. They shouldn't be going out to the mall just to hang out together. They've got to be careful just for the next few months, just as they were careful at the beginning of the pandemic. Another group that I want to speak to today is employers. Please step up and take action on outbreaks in your workplaces. I know the province has hired more labor inspectors, and I fully support any increase in inspections being undertaken by the province to make sure that workplaces are COVID compliant. But employers should be taking action before you have an inspector on your door. And the government should be enforcing action once an inspection has found shortcomings. We know people are getting sick at work, which means more protective action needs to be taken throughout workplaces, including the lunchrooms, the break rooms. Sadly, some people are coming to work sick. I know many people are terrified of losing their jobs and the paycheck that goes with those jobs, and that is why they come to work, even if they are experiencing symptoms. They feel it is better for them to come to work and keep their paycheck than to go and get tested and take a chance they'll be testing positive and lose their paycheck. I've heard from healthcare workers when we've been out visiting some of the testing centers who tell us that people are afraid to get tested because they're afraid to lose their paycheck. A positive COVID test should not cost you either your job or your paycheck. And there have been some measures undertaken to make sure people don't lose their jobs, but there are still many people on where they get paid based on the number of hours they work and nothing more, nothing less, that are afraid of losing their paycheck. We continue to urge the other governments to work with the private sector to urgently develop for those people who are in danger of losing their paychecks if they're off work because they test positive, to make arrangements to make sure that is not the case. I urge employers to do the right thing and help their employees to get through this tough time and place health first. It's about health, and it's about doing the right thing for what I'm sure are loyal employees. It's about doing the right thing for them, but also the right thing for everybody, including all the other employees who are put at risk if people feel that they have to come to work sick rather than getting tested. I encourage larger employers to address this problem now within their companies. They don't have to wait for government regulation in order to do something that will provide much bigger protection at a relatively modest cost so that everyone can get tested with confidence. I'd like to now ask Dr. Davila to provide her remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 445 new COVID-19 cases. 191 people in Toronto are in hospital with COVID-19, and 44 people are in intensive care units. When I spoke to you on Monday, there were 176 people in hospital and 42 of them in ICU. On 15 of the 18 days so far this month, at least 10 people have been admitted to hospital with COVID-19. On 15 of the 18 days so far this month, the number of people in hospital with COVID-19 has been above 150. The hospitalization rates suggest that COVID-19 is slowly and steadily manifesting again as an illness that is putting people in hospital. There is no guarantee that slow and steady will not shift to rapidly overwhelming. The latest percent positivity figure for Toronto is now 6.2%. A week ago, it was 5.9%. The most recent percent positivity figures are noticeably higher for two age categories. For teenagers between the ages of 14 and 17, the percent positivity rate is 7.5%. For young people between the ages of 18 and 23, it's 8.2%. For parents, this is something to think about seriously. As a parent to teenagers, I know that as younger people become more independent, it doesn't always appear that they're taking our advice seriously. But I know firsthand that our advice is seldom ignored entirely. I know that in these circumstances, as parents, we will all want to have said and done everything we could have to help keep our children safe. I urge you not to find yourself wishing you'd said something when you had the chance. Yesterday, we saw 559 new COVID-19 cases. That's one of 5 days this month with 500 or more confirmed cases. Those 5 days have all occurred since November the 9th. There are currently 27 outbreaks in long-term care settings, 7 in retirement homes, and 13 in hospital settings. I'm sad to report that we are also reporting 22 deaths today, with 21 linked to long-term care home outbreaks. This means that all but one of those deaths occurred in a setting where vulnerability to the worst outcomes from COVID-19 runs high. We're close to 1,100 deaths in long-term care and retirement homes since the pandemic began. And we have seen a total of 1,490 deaths in our city thus far. On behalf of my team, I extend my deepest sympathies to those who have lost loved ones to COVID-19 and send our well wishes to those who are sick and recovering from this illness. While infection prevention and control measures in these settings have improved greatly, we must always remember the vulnerability of the people who live in them, given their age and frequent underlying conditions. COVID-19 is still finding a way into these settings. This reinforces the pressing need for us to limit our exposure to people we don't live with. Because before COVID-19 starts spreading in any setting, someone, somehow, brought it in, possibly without even knowing it. This is the risk of socializing, especially with guards down and masks off. In times like this, it's natural to want to enjoy the company of our friends, our colleagues, and our families, and to forget about all of this, even if just for a little while. The need to feel normal is powerful. But ironically, that need may well be playing the biggest part in sustaining the circumstances we're trying to forget about. We may, as individuals, be willing to take on the risk of COVID-19. It is worth remembering, though, that we don't take on the risk alone. Someone's mild illness could be someone else's fatal illness. Whichever public health measures we can put in place to limit the spread of COVID-19, the most effective limits are the ones we set for ourselves. So I ask you again to think about your limits and what that can mean for you and the people around you in the weeks ahead. I'll now turn it back over to Brad.
Thank you, Dr. Davila. On the line today, we have a number of staff who can answer specific questions if need be, including Chief Pegg, Marianne Bedard from Shelters, Carlton Grant from Municipal Licensing and Standards, as well as Paul Raftis from Long-Term Care, as well as staff from PFNR, Parks, Forestry and Rec, and Transportation. First question is to Janice Golding. We will unmute you now, by the way, on this end. We've got some new software, so We'll unmute Janice and go ahead, Janice.
Oh, hi, can you hear me?
Yes, Janice, go ahead, thanks.
Okay, so we just like to know, there is currently an outbreak at Fudge House. 112 residents tested positive, 29 active cases. There are 250 beds in this long-term care facility. 9 residents have now died. This is a city-run facility. I know that enhanced measures were put in place in March and April when we saw the number of deaths in long-term care facilities go up so high. We're just wondering how this ended up happening again at a city-run facility when you have almost half of the residents having tested positive for COVID-19.
I'll turn this over, Janice, to Paul Raftis, who's our General Manager of Senior Services and Long-Term Care. Paul, please go ahead.
Hi, Janice. Thanks very much for the question. Yes, we have experienced the extreme challenge of asymptomatic transmission quite a number of times since the beginning of the pandemic. So we've actually experienced at our 10 facilities more than 35 outbreaks, and we've successfully worked through all of those. Fudge House is a very unique challenge with this outbreak. Very tight infrastructure there. All of the rooms are shared, narrow hallways, etc. So since the beginning of the outbreak that started on October 12th, we haven't gone this ourselves. We have worked with Toronto Public Health very closely around the clock. We've been working with hospital partners, IPAC experts to make sure that we're focusing on prevention and mitigation to stop the spread of the illness. So on the prevention side, certainly there's active screening 24 hours a day, masking 24 hours a day. All non-essential visits have been canceled, and we've enhanced all of our IPAC practices within the home. On the mitigation side, certainly we have isolated all of the residents. We have physical distancing and PPE going at all times through the home, and we're working with these experts to absolutely limit the spread and stop the spread.
Okay, do you feel at this point that you have a handle on the situation? Do you feel like you're getting the numbers under control?
Yes, we have all resources focused on this, all experts. We've overstaffed the homes. We have a number of physicians in the homes 7 days a week, and we're doing absolutely everything to manage the outbreak.
Okay, thank you, Paul. We'll go next to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi there. This question, I think, is for Dr. Davila. We're hearing from some of your colleagues in 905 belt municipalities that they kind of feel like they're running out of things to try, and they're seeing the numbers go up no matter what. So I'm wondering if you feel that way, and if you can share any of the recommendations you've made to the province about what you think might make Toronto safer from this virus.
So, you know, I'm sad to hear that people feel that they're running out of options. I do think that there are a number of options yet available to us, and it's a combination of things. So, as we've spoken of many, many times over the course of the last several weeks, we know more and more about this virus. It's not to say that we've got it all figured out, as we've just heard within the context of long-term care. It actually is a very, very difficult virus to control in terms of transmission. But there are some clear areas of activity where we can have impact based on our own experiences from the earlier wave of COVID-19 activity and from the experiences of other jurisdictions. So measures that we can take, restrictions that we can take together, particularly if done across jurisdictions, that actually limit the likelihood or the possibility for people to come into close contact with each other in crowds or in congregate groups and in closed settings. The kinds of actions that can be taken to reduce those activities are going to help reduce transmission. Over and above that, supports, enhanced supports that can be provided by government in order to facilitate the ability of people to do the right thing, to stay home from work when they're sick, to take time off to go and get tested if they develop symptoms, to make that testing easier to access. These are the kinds of supports that can actually make it easier for us to identify COVID-19 quickly and then to control it and limit its spread as quickly as possible. So I think it's that combination of efforts that really is about taking what we've learned about COVID-19 over the course of the last several months and putting it to good use to protect the health of Torontonians and people in the 905.
Okay, thank you. I guess a follow-up to that is you maybe artfully didn't answer my question about what you've recommended to the province. So I'll ask if there's any of those you can share, understanding they may or may not become reality depending on what happens. And specifically, if that might include gatherings for things like weddings, which are still a recommendation for Toronto, but not a hard cap, just a 30% of occupancy, but not a maximum number. Thank you.
So, David, at this point, I'm not going to get into the specifics of what we've discussed, but suffice it to say that we've had active discussions with our provincial colleagues and counterparts, and as well active discussions with local public health authorities from all around the province, looking at exactly the kinds of restrictions or enhanced measures that I was speaking of, and also the kinds of supports that make it easier for people to do the right thing, to get themselves tested, to take the time off work, and to stay home when they're sick. It's that whole package of restrictions, measures, and supports that I think will see us well in terms of protecting the health of the people of Toronto and Ontario.
Okay, thank you. We'll go next to John Chidley-Hill from the Canadian Press. John, go ahead.
Thanks. Good afternoon. This question's for Mayor Tory. Mr. Mayor, a little over an hour ago, Premier Ford said that he finds the case totals in Toronto and Peel and York regions extremely troubling, and that he and his cabinet are discussing further restrictions in these three regions. I'm sure you've spoken to the Premier, but I'm curious, what's your reaction to that news?
I'm glad that they're considering what has been a very complete summary that has been provided in the course of the discussions between ourselves and the province, between ourselves and the other partners in the region, in order to try and keep people healthy. And I've made it very clear to the Premier, but I've made it clear publicly as well, that I think more needs to be done. They have a process that's a little bit different than what we have at the local level, where they have a cabinet to deal with and a provincial health table and things like that. I hope they complete their deliberations as soon as possible, because I think the time for action is now. I will just say that without getting into the details, they have a very complete understanding, I think, of what we think is necessary for Toronto, and those are the things we think should be done. And if they choose to to go in a different direction, we'll have to consider what we can do on our own to try and improve the numbers in Toronto, which are deeply troubling.
Mm-hmm. As a follow-up to both you and Dr. Davila, if those restrictions basically amount to a regional lockdown for Toronto and its neighboring regions, how would you feel about that extreme step?
I will only say to start off that we've always felt that the more we can cooperate with each other, and I think we've been leaders in trying to ensure that cooperation. I convene meetings of the mayors at the political level each week, every Monday. Dr. Davila, she'll, I'm sure, say, talks to her counterparts all the time. And the most important reason why it's better isn't because we all talk to each other and get along. We all get along anyway. We're trying to cooperate. It's because it is simpler for the public to understand, one set of rules. And that's why I said in my remarks earlier that it's best if this kind of measure comes from the province, because then it's very straightforward as to, one set of rules that apply across the region. So we would be happy, I think, with that result. At least I would be, from the standpoint of simplicity, and Dr. Davila can speak to the health aspects of it.
Yeah, so from a public health perspective, simplicity is part and parcel of making sure that the public health objectives can be achieved. So simply put, I would say this: evidence-informed measures to protect the public as best as possible from the negative impacts of COVID-19 are something that I wholeheartedly support. I would say, though, that it's important as well to think about the supports that are required over and above those restrictions and measures, in order that people can actively participate and fully participate in doing what's best, not only for their health, but the health of the community around them.
Okay, thank you. We go next to Theodore Doucette from Radio Canada.
Good afternoon. My question is for Dr. Davila. Doctor, with Toronto being in the red zone and more restriction coming on, as Premier Ford just announced, can you have a word towards the people who are already confronted to mental health issues related to social isolation, please?
Yes, I mean, clearly this is one of an important concern related to COVID-19 and some of the restrictions that have been put into place. Recently at the Board of Health meeting, we talked about the importance of mental health to overall health and the kinds of measures that need to be put in place in order to best support mental health given the circumstances that we find ourselves in with COVID-19 and the measures that are needing to be taken in order to control COVID-19 as best as possible. Mental health is obviously an important aspect of health. You can't have overall health without good mental health. So there are a number of services that are available. So this is one of those supports, one of those enhanced supports that's needed in order to manage COVID-19 and its health impact overall. So over and above the restrictions and measures that we're talking about, we do know that supports need to be put in place to manage things like mental health challenges that may arise as a result of the COVID-19 control measures that are put into place. So certainly we're working with our healthcare partners, we're working with partners all throughout the city, community agencies, but I think as well at an individual level, to the extent that each one of us can reach out to those around us, to our neighbors, our families, our friends. If we know that somebody is struggling, I would encourage each and every one of us to reach out and be that friend, be that support in order to alleviate any challenge. And of course, here in the City of Toronto, 311 is available. The hotline at Toronto Public Health, 416-338-7600, we're also available to provide supports and referrals to the various mental health agencies and mental health care service providers that are available in the city.
Thank you, Doctor. You're talking about measures to put in place. Are you planning to release more tools or funds to fight against the psychological issues?
Well, certainly we know that there is more funding, and this existed pre-COVID-19, that mental health services require appropriate funding in order for them to be available to meet the needs of the population. That's certainly one of the elements that's out there. Service access is premised on funding, and as well, again, I can't emphasize enough how important it is for each and every one of us, outside of professional services that can be made available through the healthcare system, and outside of connections that can be forged through community agencies and social service agencies, which are just as important to mental health. I would be remiss if I didn't mention that there is a role for each and every one of us to serve as a lifeline and a friend to those around us in our community, whether we're talking about our work colleagues, our family members, our friends, our relatives. I think we all have a role to play in supporting each other and being that network of strength and support.
Okay, thank you. Final question is to Jeff Gray of the Globe and Mail. Jeff, go ahead, please.
Hi. Thanks, Brett. I wanted to ask, I know you won't get into the specifics of the recommendations, but can you give us a sense of what we should expect? Are we talking about, for example, the prospect of closing indoor retail, going to curbside pickup only, or closing malls, that type of thing, or more restrictions on capacity for stores, hours, or something of that nature?
So, Jeff, you know, these are the subject of active discussions right now. So I don't know that I can really provide more by way of detail. But suffice it to say that what has been put forward and what is constantly in discussion are evidence-informed measures to help reduce the spread of COVID-19, both premised on our own experiences, that which we see in the literature, and the experiences of other jurisdictions. Again, I think it's really important, though, that we mention that it's not just about restrictions. Ensuring that we are also at the same time having conversations around evidence-informed supports that actually facilitate the ability of people to do the right thing. As I said, to stay home when they're sick, to go and get tested, to not go to work, feeling unwell or with symptoms. Supports that actually support people and facilitate the ability of people to do the right thing, to protect their own health and the health of the community around them, are just as important as the kinds of things that we discuss when we talk about public health measures and additional restrictions. But all of this is aimed towards reducing the conditions that give rise to COVID-19 spread.
Thanks. And maybe a question that also the mayor might want to chime in too. Just listening to both of you speak today, and the situation we've now found ourselves in with the numbers and the restrictions set as they are. A lot of people are pointing to the sort of contradictions of this whole thing. I mean, Dr. DeVille, you mentioned about malls. Now is not the time to go to a mall. The mayor mentioned Black Friday, but malls and retail remain open. Is there a danger that people are looking at the message of stay home, but stores are open, and sort of throwing up their hands?
So, Jeff, it's hard for me to comment on what people may feel out there, but I will say this. There are active conversations going on all the time. We have been in active conversation for several days now with our provincial counterparts, and certainly for a similar duration with other local public health units. And the various options are being discussed. They are all evidence-informed, and they are also discussions reflecting supports and messaging that helps the public to make good decisions for themselves. So I think there are roles and that we can play as government, actions that we can take as government in order to support our efforts or overall efforts to reduce the spread of COVID-19. There are roles that the public can play and messages that we're trying to convey to them. I think they're better done, as the mayor has commented, in a regional fashion, so we have a singular voice and a singular message that's easier to grasp. And I hope that we will have more to share by way of detail in the near future.
Jeff, can I just add to that simply this? Wouldn't it be much simpler and much more effective if people would just stay home? Because then you don't have to worry. I mean, I was honest enough to say the other day that one of the reasons you bring in these restrictions is, in fact, to reduce the number of places people have to go so that they won't go somewhere where they're going to be in contact with others and where there's going to be crowd scenes. But if people would just follow the advice, which is fairly straightforward to follow for most people most of the time. There are those who have to go out to work and so on. We understand that. But if people would just stay home and not socialize and not choose now, of all times, to be going to do advanced Black Friday shopping or advanced Christmas shopping or whatever, this would be much better for the next period of time to, wrestle this virus to the ground. So that would be the best thing that would happen. But in the absence of that, we have to look at other ways in which we can cause these crowd scenes not to occur. And so those are the things that are under very active discussion, because we believe as a city very strongly, the medical officer and myself as mayor, that we have to do more in order to take these numbers that are clearly alarming and bring them under control.
All right, thank you, Mayor. Thank you for joining us. That concludes today's briefing. Please stay well.